Do you know what the most misunderstood organ in the male body is? The prostate. Most people don't even know where it is. If they know where it is, they don't know what it does. And if they know what it does, they don't know how it does it. So we're going to review all these topics, and more in today's video. Welcome to Health Conscious. We produce daily videos on a wide range of health-related subjects. First things first, the prostate is a gland that only men have. The prostate isn't very big, about the size of a golf ball, and it sits right below your bladder. Although it's not very large, it virtually guarantees problems when something goes awry. Let's talk about what the prostate actually does. The main job of the prostate is to secrete a milky white fluid that nourishes and protects your sperm. Almost 30% of your semen is made up of this fluid. This fluid is alkaline, which means it has a high pH, and it protects your sperm in the acidic environment within the vagina. It essentially allows your sperm to reach and fertilize the egg. The prostate needs testosterone, specifically dihydrotestosterone, in order to function properly. So when you're younger it stays healthy and working as intended, but as we'll talk about later, extended exposure to the hormone can create issues with your prostate. The prostate, like all other organs, can have things go wrong. Most commonly you'll hear about BPH, which stands for benign prostatic hyperplasia. What happens is, as men age, the prostate gets bigger in size, because of new cell creation. You have a transition area in your prostate. This transition zone surrounds the urethra, and the urethra is the component which links the bladder to the penis. This is the area that actually demonstrates new cell formation, and these new cells end up putting pressure onto the urethra, making it difficult for urine to pass through. As you can imagine, this is very uncomfortable and it prevents you from urinating properly. Check out our free prostate health quiz in the description if you have issues with urination. Some common symptoms of BPH include excess urination at night, weak streams, difficulty urinating, and dribbling of urine into your underwear after peeing. These symptoms can lead to infection, kidney stones, and even bladder rupture. Next up is prostate cancer. It's the #1 cancer for males, and #2 in death rate for cancer in males. Prostate cancer is an uncontrollable accumulation of abnormal cells. Generally, prostate cancer is most commonly diagnosed in men over the age of 50. In autopsies, up to 80% of men over the age of 70 will have some sort of prostate cancer. In fact, some people currently living with prostate cancer end up dying from other causes as it's a very slow-growing cancer. Local or regional prostate cancer has a 5-year survival rate of 100%. However, prostate cancers that have spread to other parts of the body have a much lower survival rate of about 30%. Diagnosis of prostate cancer is made by a combination of imaging and biopsy. When you get a biopsy performed, the doctor will get reporting back with something called a Gleason score. The Gleason score ranges from 2 to 10, based on how aggressive your cancer is, 10 being the most aggressive. Treatment of prostate cancer is always decided on a case-by-case basis. Deciding upon active surveillance or other treatments is a very nuanced matter, and it's really important that you have a healthy line of communication with your doctor to see what's best. Another method of testing is called a PSA test. The PSA test is a blood test that checks for the prostate-specific antigen within your blood. The PSA is something that both normal and abnormal cells within your prostate secrete. There's a normal range that we would expect the test number to fall into if you don't have cancer, and cases with numbers above that range are generally looked into further. However, the PSA test isn't foolproof. If you have an inflamed or enlarged prostate already, the number can deviate above the normal range. This is the main dilemma with the PSA blood test. Everyone wants to catch cancer as early as possible, and if the test comes up positive, you can be overdiagnosed with prostate cancer. A decent amount of prostate cancers found utilizing PSAs would have never caused symptoms for patients within their lifetimes. It's also very possible to get a false positive, leading to an unnecessary biopsy and medications, which both carry their own sets of complications. And worst of all, it's possible to get a false negative, which means that you actually have cancer, but the test falsely reassures you that you don't. There is no universal recommendation on who should get a PSA test. This is due to the fact that the test can provide us some indication, but can also carry significant negatives. Another preventative measure exists that's very commonly associated with prostate cancer, and that's the DRE. The digital rectal exam is exactly what you think it is. It's a digit, or a finger, from behind, to make sure that the prostate doesn't have any masses. It doesn't have an unusual shape, it's not larger than normal. While this test is still widely used, its evidence for finding cancers and for extending life varies from doctor to doctor. That doesn't mean the test is useless. It definitely has some utility, but it's important that you discuss with your doctor whether or not you need the prostate exam, or if it's something you could pass on. Our short online quiz in the description below has two formats, one if you're watching on mobile, and one if you're using a computer. Utilize the free quiz to get a better understanding of your current prostate health. Thank you for watching Health Conscious. If you found the video informative, give it a thumbs up and share it with your friends. For more helpful videos like this one, subscribe and turn on notifications.